etc. I've taught nurses and midwives and doulas for the past 20 years. I have taught evidence-based maternity midwifery aromatherapy. I've done that in the United States. I've done that in Europe, England, and have been to South America, to Chile twice to teach midwives. So that's really kind of my heart and soul. And the fire for women's health and women's issues has always burned in my soul. And my goal has always been to get this wonderful information and this wonderful modality that we all love out to as many women in the world as possible. And that's why I agreed to do this tonight, because as much as I can share with you, you touch hundreds of people yourself, and we just kind of have this wonderful domino effect. And we're predominantly, there's certainly men in the field, but like my original field of nursing, it's mostly a female field as well. So as I tell all my students, everything that I teach them for their patients starts, I want them to use it for themselves. I want them to help themselves and feel good physically and feel good emotionally, because we have a lot on our shoulders and a lot to take care of. And so everything that we learn and teach each other, it starts with ourselves and making sure that we stay okay. So anyway, with that said, you can read blips about my background. I did postpartum depression, published research in 2012. We did a year-long study, and that really kind of, I'd say, got this ball rolling in that direction. I myself have been a psychiatric nurse 30 years ago through now, a women's health adjunct person and nurse and friend and therapist for years. And these things just all kind of weave together. Everything that I've ever done, be it as an emergency room trauma nurse, with patients before they went into surgery, or with women when they're having babies, menopause, the whole thing, the thread of emotional health goes through these. So people know me predominantly for the background with OB, the background with maternity, with my research and the book that I wrote. And the true background is the emotional health part that goes through every single thing. If somebody has pain in their hip, or they're having a baby, or they're grieving, or any number of those things, our emotional health is always at play. So when I was asked to write a second book, they asked if I had, knew anything about mental health, because it was becoming kind of the popular topic, isn't it? It's so funny to be this age and stage in life when it was such a stigma to talk about. People had to deal with their emotions and their mental health, or their family's mental health, kind of behind the scenes. And now it's out there front and center every day and all the time. So it's just such an interesting time. So we're going to talk a little bit about that. This is just really a taster, just a little bit about it. It's not really that formal of a presentation. It's just me kind of telling you a teeny bit about what I do and what you already do, and a little bit about my books and research and where you can find more. So why won't it go to the next screen? All right, I want to thank you for having me. I always love to be with you and to share, as I said before, so that we can just keep spreading the good aromatic love. And I appreciate IFPA. I lived in England for 2 years. My husband was transferred over there from 2000 actually to 2004. I went to graduate school in London. I already had been certified in clinical aromatherapy. So I just took that, went over there where so much was already going on clinically in oncology and in women's health. And I pretty much just stalked all the experts and worked in a hospital with Denise Turan for about 1.5 years while I was going to graduate school. And I joined IFPA. So this is near and dear to my heart to return to IFPA. That was I went to a NAHA convention here, and then we moved to England. And then the next 2.5 years, I would go to the IFPA conferences. And so it's near and dear to my heart, and it's fun to be back and to do it on my own shore as well. So what is mental health? Okay. We know what mental health is, but a few of the definitions of it includes our emotional, our psychological, our social well-being. It affects how we think, how we feel, how we act. It also determines how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And I think that's so important, and I really focus on that as a mother. And I have adult children now, but raising them, I was an integrative nurse, and aromatherapy came into my life when they were very young. And so they grew up with that along with other herbals. I was trained and educated in herbal medicine, as well as a little bit of homeopathy and Bach flower, et cetera, as many of us are. So they had that, and just seeing the stages of their life, and even to this day, still using aromatherapy, and they're young professional adults at this time, and have really grown to, by experience, to appreciate what it can do for them. So that's one of the things I do love, working with women in pregnancy through childbirth, because I believe if we teach them during that time, the more they learn, the more they're going to be able to teach their children and raise the next generation. I don't think it's the be all and end all. I look at aromatherapy as a complementary therapy. It can stand alone for minor illness and injuries. It can be a beautiful enhancement to our life, especially our emotional well-being. And it helps a lot with the side effects of a lot of medical conditions. So that's, as a nurse, that's how I've been able to have aromatherapy programs, and kind of to get into that realm, to look at it and to present it as a complementary therapy. And I learned that when I was in England, that a complementary therapy is not as an alternative therapy. It's not a standalone. It's not a standalone. It doesn't diagnose and treat, but it stands alongside of, and certainly can treat a lot of our minor everyday illnesses, and keep us, keep us healing, and keep us from catching illnesses. I've gone back to work in the hospital a little bit, and we're in the middle again of the flus and COVID, etc. Some of us are wearing masks, but I use oils all the time and all day long when I'm there, and have done pretty well. So I'm really, really grateful to have that in my life. Back to mental health, a person's condition with regard to their psychological and emotional well-being, and our feelings and thoughts, and how we're affected by them. So it is massive. And the other part of it's not standalone. It's in every cell of our body. And everything that I talk about is for those of us who are not diagnosed, and we're amongst the walking wounded in the world, um, all the way from just the everyday anxieties, everyday kind of highs and lows, all the way to somebody who really does have a psychiatric diagnosis. We can use aromatherapy, and we do use aromatherapy across the board. Having worked in a psychiatric unit in my life, people who are really have a psychiatric diagnosis, who are out of touch with reality, they're very scared. It's a very scary thing for them. And aromatherapy can be helpful to help calm them down, and they're less agitated. So you can use it. You can use it for kind of all across the board. Anxiety is anxiety. And the more kind of terrifying things that are going on in your life, the higher your anxiety is going to be. I put this screen up here just in case you're not aware. When my mental health guidebook was published in August simultaneously, I designed these logos, and I designed them to share with the world, essentially. And if any of you want them in French, Spanish, English, Portuguese, and the English one does not have my name on it, I will send it to you for free. I paid for them and designed them. And the reason I did that is so that we could have a universal symbol that everybody could see, and they just see that mortar and pestle and the lavender coming out of it, and the green European pharmacy cross, and they know the healing properties. And if we have this as our logo and this is our symbol, you can be in China, you can be in Czechoslovakia, Czech Republic, you can be in Indianapolis where I'm at, and you see that and go, oh yes, aromatherapy is helpful for mental health. Let me check into that. What's that all about? Could that help me feel better? So if you want one of these, just let me know. Just send me your email, and I'll be happy to send you one. And I just ask that you use it somehow in an outward fashion, be that on your website or your Facebook or any of your correspondence. So with that, I just wanted to tell you that this is one of the quotes from my book. The human condition includes a vast array of emotions, just as Mother Nature's garden includes bark, leaves, needles, sap, flowers, leaves again, seeds, cones, roots, berries, full of intricate components for the plant's survival, as well as therapeutic value for humans. That could be in our backyard, in our garden, that could be in our kitchen. And what we know is that's where our oils come from. The pleasurable sensations one feels from the scents wafting through the forest, on a nature hike, a rose bouquet from a lover, or cinnamon rolls baking in the oven highlight the provocative effect of our sense of smell. These emotions can be invoked with our essential oils from these plants, triggering positive memories, uplifting spirits, and tapping into long ago mind-body sensations. We all do this with every single treatment. And ever since you've been in aromatherapy, you've been doing this. You don't really need someone like myself to tell you how you have wonderful skills and knowledge to help people with their anxiety, with their panic, with their depression, with their grief. And those really are kind of the four areas that we deal with on a very, very regular basis. And if you haven't noticed, all these conditions have really escalated. And like I said, I'm just going to touch on a few things tonight, but you can get multiple studies in this guidebook. And it's not very big, like my other one. They're not big, so they're easy. They're concise, they're practical. A lot of practitioners really like them because they can, just have them like in their desk and just quickly refer to them. And you have many other oils. It's not exhaustive. My work is just always evidence-based. And the mental health one also has anecdotal components to it. But I think it's important when we look at mental health to look at how huge of an issue it is right now. And it's really hard to say, since we've had to keep this quiet. People were locked away on the Hill. People were locked away in sanatoriums for ages. So we really didn't know. They put people who were epileptic. I had an uncle who was institutionalized for epilepsy. So what we called mental illness then and what we call it now. And we also refer to things, mainly as mental health and well-being. So just a little kind of look at the statistics. As of 2022, the National Alliance on Mental Illness. So in the United States, 1 in 5 adults experience mental illness each year. With women, the reason I focus on women is we have a very obvious reason, and we have about 40 years of fluctuating hormones that greatly contribute to our emotional health, well-being, or not well-being. And those, as you know, if you're in a woman's body, you know how there's ups and downs, and we often feel that every single month. And aromatherapy can be a great savior and really, really help take the edge off. Women are strong. Women, if they are feeling like an 8 or a 10, they just want to be at least brought down to maybe a 6, a 5. They can still function in the world. It's just sometimes it gets pretty unbearable, especially when the hormonal levels are fluctuating so much. And we can do so much with aromatherapy for that. 1 in 20 US adults have a serious mental illness every year. 1 in 6 US youths, and this is so important because brain development we see now is they're not completely developed till between 26 and 30. So I know when I was in nursing school, they were just starting to introduce late stage adolescence. And they were saying, it's past 18, it's more like 20, 22. And I remember sitting in my college class at about the age of 20, and I was like, oh, relieved, thank God, because I'm still feeling those adolescent feelings and I'm still having those adolescent behaviors. So now we have more science and we know more about the neurotransmitters and we know more about the hormones and the levels and how they affect each other and how brain development isn't completely mature until the late 20s. So that's really important to keep in mind. And that also really is important to know that because Sometimes we have paradoxical reactions with oils. What I mean by paradoxical is the opposite effect than we would expect. And lavender is a really good example where oftentimes we talk about lavender calming. Sometimes with those that are there, they may have the effect of it being, more of an excitability. And so a lot of that has to do with the maturity of the brain when people have paradoxical reactions. 50% of all lifetime mental illness begins by age 14 and 75% by age 24. So that last one especially makes, well, both of them really, but makes sense to me in terms of from being a psychiatric nurse, just seeing people when they have like a schizophrenic break or have a nervous breakdown and are in that range somewhere from 18 to 24, that's kind of their first big episode. And I mean, most all of us experienced a heartbreak, experienced not being chosen for something big, experienced great disappointments, maybe a loss of a parent, a grandparent, a child during those early years that impacts you for the rest of your life. According to the National Institute of Mental Health, the prevalence of any mental illness was higher among females, 25.8% than males. And that's pretty much since they've been gathering statistics about that, about the differences, we're always higher. Mental health globally, according to the World Health Organization, and I think we all feel this, the COVID pandemic triggered a 25% increase, and now they think it may even be higher than that, depending on the age of the person when they, when we were isolated and when the world really kind of changed. If people were just coming of age and missed a lot of those kind of traditional markers, they may suffer more. So increases in the anxiety and depression. Anxiety as of March 2022, 27% reported symptoms of anxiety and 37% at the peak in 2021. Depression, 21% of US adults. So the anxiety, just kind of take this as the things that we're treating every day. The main thing is anxiety, some version of anxiety, from butterflies in the stomach all the way to full-blown panic, which we're seeing a lot of the panic. Everybody has anxiety. It's normal. It's normal to feel anxious about everyday stresses and strains. So it's not something that we're going to eradicate because it's a normal human emotion. It's when it causes people to not be able to function in the way they need to. And the quickest way and the most simple way, and I feel like I'm preaching to the choir because I know you all know this, so don't anybody be insulted if you're like, of course I know about inhalation. And we use almost 100% of the time the method that we use with aromatherapy for anxiety and for panic is almost exclusively inhalation. It works quickly. It works very effectively. And it's easy for people to do. It's much more user friendly, and obviously you can do it. When I talk about that, I'm talking about, we use these cotton pads a lot where we put the drop on the pad and people just keep these, use these. They can put them in a Ziploc bag, maybe have it in their backpack or their purse, take to school, take to work. And they like these because the drops stay put. If somebody's going to use oils for anxiety for a longer period of time, maybe they're going through a cancer treatment, maybe they really need it for several days around PMS or PMDD, they're going to maybe want to have one of those beautiful inhalers or one of the plastic inhalers, just something that's compact, that's there kind of more medicinally. Women in mental health, we have a higher incidence of anxiety and depression. The rates increase dramatically, as I just talked about. Our hormonal fluctuations are 40 years of our reproductive cycles. We have higher rates of poverty, women do. Single mothers, sole responsibility for children, lower rates of higher education, multiple jobs, so many stressors, financial stressors. We can go on and on about things that have happened to women that make them more stressed, but we can be there with something as simple as our everyday, and what's been most studied is lavender. And lavender, unless somebody's allergic to it, somebody has asthma and that, that really exacerbates it, that's the one that's been studied the most for anxiety and depression, far more than any other oil. So it's kind of your go-to by inhalation. Fortunately, there's other oils as well, but we don't need to make this more complicated. We don't need to make it like some big fancy blend. Those of us who have studied and are certified aromatherapists, like I imagine you all are, we learned our individual single oils, and that is what is evidence-based. The blends that companies talk about with fancy names oftentimes have like 8 to 13 different oils in them. So it's hard to tell which of those oils is really working, which one is really helping, and do you need all those? So I talk mainly about single oils, and yes, absolutely, you can mix those single oils together, and we're not one size fits all. And that is kind of a neat thing about working with women, is depending on where they're at in their cycle, or if they're ending like more premenopause, perimenopause, menopause, that you're going to maybe tweak those oils a little bit. So we'll get on to that in a minute. But just talking about teens, I work a lot with teens. I'm sure many of you work with teens. And I'm thinking of males and females. I'm a mother of both. I have a son and I have a daughter. And so I've worked extensively with both and with their friends. But I'm more specifically talking about females. And females, just with the start of their kind of the reproductive system and starting their period. We may use different languages. So I'm not sure where you're all from. But the surge of hormones known as puberty typically begins in the teenage years, as we know, where the body has all these changes. But the young female, can maybe for a couple of years, even before her actual flow starts, may start having those wacky emotions. And aromatherapy is absolutely wonderful for that. We use a lot of the citruses. Oftentimes, the teens prefer like the bergamot, the mandarin. If they have choices and have control, they feel like it's theirs. If they're really having anger, irritability, those outbursts might add some ylang ylang with that. But that's pretty strong, so you want to keep the amount down. But working with girls as they're just starting their period, that kind of 11, 12, 13, oftentimes just Roman chamomile. They're feeling some cramps. They're scared. They don't know what's happening to their body. They don't really have a full understanding. So have them kind of choose between a Roman chamomile, a mandarin, a bergamot. You can have a lavender in there. But you can just have them, pick themselves, and that they're more likely to use it if they've been empowered to make their own choice and put their label and all that stuff on it. Menarche, which is the beginning of the flow, the beginning of the period, is the final stages of puberty, and it's usually preceded, as I was sharing, but just all those differences in their body. I am really committed to, and I actually did this with my daughter. I think if we can kind of change the narrative and change the script from the curse of having a period and all the negativity around that to the blessing. And if we as adult females are as positive as we can possibly be, also acknowledging that there's going to be discomforts and you're now fertile and all the rest of those responsible things, what a blessing to have a female body. What an absolute miracle we're designed to do. And if we start with that, what we have noticed is cramps are less. When we infuse this with oils and they learn what oils are helpful for cramps, then they're less agitated, they're calmer, and have had a lot of luck with like Roman chamomile with that. And it helps them sleep. So they're kind of dancing between being a child and being an adult, and us bringing comfort measures in, kind of new comfort measures, and the way to use them. Obviously, if you're having physical discomfort, diluting the oil and putting it in the area where you're uncomfortable, like lower abdomen. The surge of the hormones. So, we're going to have raising hormones, raising estrogen levels. We're also going to have the stress of raising cortisol. And just simple inhalation, you're going to bring that cortisol down, which is going to help decrease the pain perception. It is also going to calm the hormones down. So that's what we're doing with them. The surge of hormones marks the end of childhood, onset of adolescence. We know all of that. Look how young. They're starting at 9 and 10 years old in the cities now. The effects of these hormones on developing bodies and brains are usually beginning well before the teens, as we were talking. These are kind of scary things that are going on with kids. And I really think if we can just introduce them to pleasant, effective ways to just take the edge off. There's recent data that indicates that children and teens suicide attempts have increased by 50%. We know this by the emergency room records, daily suicide attempts related to their decreased social interaction. So that's getting better. But there's kind of a gap in development in certainly over here, I don't know if some are across the pond, but here in the States, we're all kind of crazy. And so people are going at each other. There's a lot of aggression. There's a lot of bullying. There's fears of guns. There's all of that. So having something, and not just one thing, but, 2 or 3 different oils for the different sensations of the milder anxiety all the way to a mild depression. And, having that in a diffuser in their room. I like this diffuser. This is kind of a big one, but this has always worked well with our family, the Aroma Steam one, where we just put the oils on the bottom of that. These are kind of big for a bedroom, but we have had them in the living room, have had them in the basement. I am not for invading people's spaces. With oils if they don't want them. So in your own private home, obviously you can do whatever you want. We have done some trials, like in psychiatric units, where we have had lavender on the unit at a distance and they have anecdotally shown like a 30% decrease in a seclude and restrain rate. We have some data on what has happened by just a mild diffusion of a single oil that they've given permission to do, and the physicians know you're doing it, and it's just an overall calm that decreases the agitation. So anyway, just ways you can do that in your own home when your child is, when she's coming home from school and she's been left out and her body's changing, and you spritz around the room like one of the citruses or ylang ylang. That goes a long way for caring, and also as they're making those changes in their life and the anxiety and depression around that. And we need to do whatever we can. And sometimes it's putting a Band-Aid on, but that Band-Aid may get them to the emergency room. That Band-Aid may just be the bridge to them surviving or just learning, yes, I can cope. So we know that common issues are focus, attention, anxiety, stress, hormonal cycles, and depression. And we have oils for all those. So we're now moving into the high school, the university students, the girls. And these studies, they were able to show that they could reduce stress, anxiety, pain with inhalations of lavender, sandalwood, rose, or bergamot, or lotion massages. And that can be just like, rubbing on their arms. It's not necessarily take all your clothes off and do a massage, or rubbing on the shoulders with lavender, sweet marjoram, and clary sage. Those were all effective, statistically significantly effective at reducing the stress, anxiety, and your pain perception, but the stress response. And so simple. In practice, we use spritzers. And when I say spritzer, I mean these bottles. So I put the oils in the bottle first, and then I might put like an absolute alcohol, if you have perfume alcohol, just like a mill over the oils, shake it, roll the bottle, fill with distilled water, or if you have sterile water, we have sterile waters on the units, and then just shaking it and spritzing it around. People really like to have these. They last forever. And some like to have smaller ones that they can just kind of keep in their room or keep in their backpack or in their office, just multiple places. These work really well in a lot of ways. They're better than this for not invading space, okay? They're better than the electric diffusers, because this can stay pretty well contained around the person. And sometimes people just want the shelter that spraying around themselves provides. And it's helping decrease their anxiety and keep them uplifted. And it's amazing what a little amount, and we usually do just 1 or 2% in those bottles. Um, a lot, and the main ones that we use are bergamot and ylang ylang, have been really helpful for irritability, and they're both evidence-based for anxiety and depression. So just playing with those together or alone, adding other citruses with those can be really helpful. For ylang ylang is my go-to, and like I said, it's also evidence-based. For anxiety, for panic, for the high irritability. There's a really interesting study, and it's in my book, about following people who had attempted suicide, and they split the group up. Anyway, ylang ylang was the oil involved, and those that had the ylang ylang, along with other therapeutic measures, but they were the ones that had lower incidence of suicide. So this can really hit some really big mental health issues. Our oils that we use all the time and we know really well, just know in your head that they're far more powerful than you think they are. And also, a lot of people are getting much more into climate, into things that are natural, not necessarily. Everything can be used with the medications, okay? We're not talking about oral use at all. We're talking only about external use, predominantly inhalation, and it can be direct or indirect, like I just showed, or body application. And that's what all is evidence-based. For focus, a lot of children and a lot of young people and adults have problems with focus. That can come about from chemotherapy. That can come about from menopause. That can come about from ADD, from ADHD, and that creates anxiety. So we have a concentration focus issue that comes about with women for all these reasons, men as well, and boys as well. But oftentimes, if you can just get more focused and uplifted, then they feel less anxious. Then they're not so fearful that they're not going to be able to accomplish a task or think a clear thought, or that they're going to lose, their cognitive abilities. If so, peppermint, rosemary, and a citrus can be really helpful by themselves, the peppermint or the rosemary, or combined. Okay, so anyway, I really liked this diagram. And actually, I just ran across it today, to be honest. And I have a study that I will share that I just ran across today too. It's actually a systematic review, but I like it a lot. It's the benefit of inhalation aromatherapy as a complementary treatment for stress and anxiety in a clinical setting. And I really like it. There's lots of studies in it. And I'm all about clinical settings because that's where I live, but I just like seeing these. And here we're looking at lavender, rose, and citrus, and those really are the top three when we're working with emotional issues, when we're working with anxiety and depression. Obviously, there's many, many more. I know there's people who really love vetiver and really love sandalwood. I don't use those so much, so those aren't necessarily my go-to, but I know a lot of people do, and patchouli, and love those. The studies we have, and it just means that some just haven't been studied. So if you're thinking about doing research, do it on something that hasn't been done on. So this just showing our oil. So a lavender, a rose, or a citrus, and it's just showing the olfactory receptors or the inhalation, how it's going through into your lungs, through your circulatory system, out through your body. And then this is where we're talking. This is what I'm talking about. We're talking about our cortisol levels. When we do all this great stuff, we're decreasing our cortisol. That's our stress hormone, right? From our adrenal glands, our stress hormone that makes everything worse, that makes us more irritable, that increases our heart rate, that increases our blood pressure, that makes us perspire, that any number of things. So just simple inhalations. The one thing we can do really, really well in aromatherapy is bring cortisol down. And it has a huge knock-on effect for anxiety coming down, panic coming down, depression improving, focus improving. If that's all that you get out of this, That's our superpower. That's why we need that logo, because aromatherapy is a superpower to bring cortisol down and improve mental health. These are the things that happen then. So you inhale these oils, right? Olfactory receptors, cardiovascular, pulmonary system, reduce cortisol. Your 5-HT, that's a precursor to your serotonin, the antidepressant hormone, right? I mean, neurotransmitter, the GABA. So the inhibitory, the calming, that goes up, increase the parasympathetic response. So we get our vital signs more in balance. And then this just took it on. They were looking at labor pain and post-op pain. And I've all along taught, even before, I'm not necessarily working in a pain center, but working in a hospital, anxiety, nausea, and pain are the three things that we're always dealing with. And when you decrease that anxiety and that stress that comes from pain, you decrease the pain perception, and then they can start to relax and reduce the pain. So there are so many knock-on effects in our emotional health that leads to our physical well-being as well by just inhalation of our oils. Okay, so for women, we're all the estrogen, the progesterone. So we get to the mid-cycle. We're now going to talk about a very specific female condition, PMS, and the worst type of PMS is PMDD, premenstrual depressive disorder. Don't have time to get into it too far, but this is very, very intense and oftentimes can go, when we think of premenstrual syndrome, we think of days before the period, like this 7 to 10 days before. Oftentimes with these people that I work with, they even have issues like 5 days after the flow has stopped. And I've been working very closely for the past year with a few clients, a couple in particular that have had this really, really badly. And aromatherapy, honestly, has been a godsend. Yes, one had to go on medications. One is doing it with a potpourri of different supplementations and herbals along with aromatherapy. When things escalate, it's like aromatherapy to the rescue. Bestie bergamot. Bestie bergamot is evidence-based. It has, as we know, helps with anxiety and really helps with that depressive component. And I have had kind of like crisis calls, like I can't find my Bestie bergamot. That it has, I know the conference that we did, the seminar that Rhiannon had in Edinburgh, so many people were talking about bergamot and how helpful bergamot had been for multiple things. Very, very helpful for the depressive component and also some of the anxiety with PMS and PMDD. One of the big things I do with this is the angst and the emotional discomfort when they get to the middle of their cycle. Like I said, about 7 days before their period starts, getting really irritable, physically and emotionally very uncomfortable. So I see a lot of irritability, a lot of sadness, weepiness. We do geranium, clary sage, rose, and ylang ylang. Any number of those. If they happen to have too high of estrogen, we don't necessarily do the clary sage, but these are our 4 go-to oils that help both physically and emotionally. They inhale them, dilute them, and put them on their body a couple times a day, just for that like week, about like 5 to 7 days before, and maybe they stop as soon as the flow starts, or maybe they do it a couple of days into it. Really, really, really helps emotionally. So here are those oils that I'm talking about. Now we're going to get to, looks like my pregnancy is coming after. So the postpartum depression, the study that we actually did it in 2010. It was a year-long study and it was published in 2012. And you can look that up. It's on PubMed. The oils that were used, and that's what I feature here, were rose and lavender. The results for both anxiety and depression were statistically significant. It has been replicated a couple times now, and it still is cited all the time. So for the interest of time, I'll just give that to you to look up on your own, and it's also in both of these guidebooks. So I want to talk about pregnancy. It's a very important time to stick with the most important time to stick with the evidence base. So we keep the moms and the babes as safe as possible. The good news is the oils that we have, even though there's just 6 of them, they're all helpful for anxiety and depression, which is so awesome. It's very important to keep the mom calmed down, to keep the woman calmed down that is pregnant, because that helps the development of the baby. And the more stress she's under, the more stress the fetus is under. And that promotes, if she's too stressed, we have higher preterm births, we have higher miscarriages, all of that. So it's very important, and aromatherapy can play a wonderful role in that. My first guidebook, as is listed there, is in English and Spanish, and there's a whole chapter on pregnancy, a whole chapter on labor, and a whole chapter on postpartum that will tell you about those oils and the ways to use them. So we're talking about lemon and peppermint are the ones that can be used in the first trimester. Then we move into lavender, and then we have the rest of these beauties, bergamot, petitgreen, and neroli. And we all know that those are fabulous. And we keep those at 0.5 to 1%. The good news is sense of smell is so intense in pregnancy. So any stronger than that is often off-putting. When I know a woman is either afraid of postpartum depression, which I talked about before, or has a history of it, I really want to start treating her in pregnancy, particularly in the last trimester, and start using those antidepressant, anti-anxiety oils. When I've done that with women who have a history and have, had issues before, we're treating them all the way through the end of pregnancy and through labor to postpartum, and they have less issues, non-existent oftentimes. Okay, so anyway, then we get to perimenopause, menopause, and we're all familiar with the things that can happen as far as depression, anxiety, irritability, feel like you're losing your mind isn't clear, you're hot and sweaty all the time, you don't feel the femininity you have before. So again, the oils that you can use, rose and jasmine, are beautiful oils that can help bring the femininity back, but also help with the depression, help with the anxiety. Both of those are real front runners. Back to the ylang for the the anger and irritability, hot flashes, the cooling with the peppermint and lavender, which also helps the emotion. So everything we're doing physically has an emotional component to it. That's why aromatherapy is a superpower for mental health. Aromatherapy is not a cure or replacement for medical or psychological evaluation or treatment. And I can't say that any stronger. I do not believe it's a cure for anything. I have started many hospital programs, taught many nurses and midwives for the last 20 years, and have been able to get in and start programs because I address it as a complementary therapy, something we can do as care and comfort strategies, no matter how strongly we feel about it and how much we know it works. The less we make it sound like it's an alternative to medicine, the better. And we can get to more people. And as I said in Edinburgh, I'd love to have sniff stands. And then I thought, in a lot of health food store, except we don't necessarily want to sniff after each other, there are all those testers. So, when we're talking to young people, they can maybe go in and put a drop on a cotton ball and just try them, and maybe have that kind of like, the street medicine, just to help them feel better when they're in times of crisis, and just try to find ways in your world to make this as accessible as possible. And it can be, as I said, it's the single oils that have been studied. There have been very few blends, and it's almost exclusively external. And inhalation is the fastest way to help with anxiety, to help with panic. And also, it's important when somebody has a kind of a long-term or a more acute, that you're more prescriptive about it, meaning you have them smell the oils, have the oils with them, treat themselves a couple of times a day. Tell them 4 times a day, so they do it 2 times a day. And tell them to do it for several weeks as opposed to just once. When it gets worse, yes, they may just go in and have, a whiff but tell them to really smell it for a couple of minutes so it has time to get into their system, and they practice that slower, deep breathing. We have found, like, when you read the studies, they're not necessarily just doing one quick inhalation. They're doing it in a manner on a regulated timetable. So the study that I did, it was 4 weeks and it was twice a week, but it was just 10 minutes twice a week for 4 weeks. And we had statistically significant results. So you need to be mindful that you give them very specific instructions. Those that are younger or aren't going to, if they just can do a whiff now and again to calm them down, that's very helpful. All serious mental health conditions, those dark, scary places one's mind can take an individual, or any inability caused by emotions to function normally for 2 consecutive weeks needs professional evaluation. So we need to know our boundaries. We need to know that this can be helpful and useful even for the sickest mentally ill people, all the way to all of us who have anxiety and depression on a regular basis. And know that you have the superpower for mental health. And if you want one of these logos, just send me your email and I'm happy to share those. And remember, these 2 guidebooks are available around the world. And I just want you to pat yourself on the back and to know whatever I've taught you, you do it all the time anyway. And this can just kind of help you a little bit more. And just kind of think about, there really, other than allergies, there really isn't anybody, unless they dislike it or have allergies,